An epidural steroid injection is a targeted delivery of local anesthetic and steroid to the area where the nerve is being pinched in the low back. It's almost always done under X-ray guidance, so we can look at exactly what level of the spine we're at, and then ultimately inject some contrast dye to make sure that things are flowing appropriately before the medication is actually given. And that helps with guaranteeing that the steroid, which is the medicine that ultimately helps your body heal, is being delivered to the right spot. Typically you're laying on your stomach for approximately 5 to 10 minutes, and the procedure is done with numbing medicine being given along the way, and the steroid being given at the end of the procedure once the needle is most appropriately positioned. Typically leading up to the procedure, the only prep work that needs to be done is if it's a cervical procedure, you would need a driver and you would need to be fasting, and these are directions that would be given to you by our nursing staff. And more importantly, if you are on blood thinning medications, we will give you instructions as to how long the medication needs to be held in preparation for the injection to prevent a bleed from happening during the injection or in the spine. During the procedure, on the day of the procedure, leading up to the injection, there's no real prep work needed, and immediately after, we ask that people do not engage in heavy lifting for 24 hours. You're not to take those anti-inflammatories and blood thinning medications for another 24 hours, and we recommend that people reacclimate into physical activity as soon as they can. A good epidural steroid injection should last approximately 3 months. That is a very objective response to how long an epidural steroid injection can last. That does not mean that the pain will come back in 3 months. Typically, the steroid enables your body to heal and decrease the inflammation of the area where that nerve compression is happening. So if your body is in fact healing, it may even last significantly longer than that. If you get only 3 to 4 weeks of relief, then that's the time where we start considering whether or not an alternative kind of epidural steroid injection is appropriate, whether or not supplementing with nerve pain medicine is appropriate, or whether or not considering a referral to neurosurgery is appropriate for a surgical decompression. Epidural steroid injections are typically used in 2 contexts. The first is if you are early in middle age, you have an initial disc herniation, and you get an epidural steroid injection approximately once every 3 to 4 months, or when the pain recurs, in anticipation that eventually your body will heal and you will no longer need injections. And that typically happens about 80% of the time, depending on the kind of disc herniation that you have and the extent of the nerve compression that you have. The other context in which we do epidural steroid injections are for patients who are not good surgical candidates. Perhaps they have much higher anesthetic risk related to other medical problems, or they've already had surgery and they're no longer operable. And in that situation, the epidural steroid injections are done in the context of allowing patients to maintain reasonable pain control and functionality for the foreseeable future. And in that situation, you can do an epidural steroid injection approximately every 3 months. Typically in our practice, epidural steroid injections can be done for anybody between teenage age, ultimately to being 80 to 90 years old. It's a very broadly used treatment modality. The only logistical concerns are the ability to lay on one's stomach for 4 or 5 minutes, and to make sure that there's no medication allergies, and to ultimately have a very thorough conversation with your pain management physician as to the risks and the benefits of the procedure. The goal is ultimately to deliver conservative management to allow one's body to heal itself and avoid surgery. If you want to learn more about epidural steroid injections, the best course of action would be to contact your primary care physician or the Iowa Clinic in the pain management department, and you can schedule an appointment to talk to one of our providers to discuss whether or not this treatment is appropriate for you.